Rhode Island and Maine will certainly have a vested interest in what we learn.
The goal of the research is to understand how different environmental exposures, like extreme heat and flooding, extreme cold, can affect human health using statistics.
So we analyze statewide patient data to look at how different communities are affected by heat.
The data we collect is already publicly available on the weather side and climate side. So that would be data from weather stations or publicly available climate weather models. And on the health side, we're obtaining it from government agencies that kind of bring together lots of health data.
So the specific information around a patient, so we'll understand their age, their gender, their sex, and we'll understand their zip code, and then we understand what they were diagnosed with and when they presented to the emergency department and the hospital. So it doesn't give us the entire picture of what happened to them, but it gives us enough information to understand health outcomes on a community level or on a state level. We're able to link that information to climate models to understand that risk exposure.
We can build on those statistics as well to look at those associations between climate hazards and population and learn whether some people are more exposed to risk than others. And then from that we can build up to actual models where we might try to do something more predictive or project into the future what future risk might be.
And so there are a number of statistical models that can do this, but the most basic is a regression model, which just says, does the average temperature in the past few days correspond to the average number of health events? And then there are more complicated things that can kind of be added on top of that, but that's the most basic sense.
So we try to look at health data from a wide lens to understand really the breadth of impacts that these environmental exposures are having on our patient populations.
The data and the models will hopefully give us insights into who is most at risk when there's a heat wave. That's something that physicians, public health officials, even community leaders can use to protect the most vulnerable members of our community.
And those are all of the reasons why we need to make this a community engaged process and engage community members around those questions of what are their aspirations, hopes, and dreams for their communities, and how can we help them get to what they want.